Good evening. Short video about healthcare, which is provincially delivered, but the Canada Health Act is a federal document, and it spells out how the provinces will deliver healthcare. So there's four big changes that the Greens want to make with regards to healthcare. First thing, big thing, is pharmacare. Now, there's been actually discussions about pharmacare since the 1940s, before Medicare was even a thing. It's always been recommended, and it's interesting that over the last several decades, since the 1940s, it just hasn't happened. There are two industries that will not benefit at all by pharmacare being introduced, and those are, of course, the pharmaceutical industry and the insurance industry. But anyways, pharmacare. Why do I like that as a family doctor? To be honest, I normally try and use the lifestyle to help people for chronic health issues so that they may not need to use medications, but I'm very pro-medication as necessary. And I like pharmacare because if a person's unable or unwilling to change their lifestyle, or even if they change their lifestyle and they still require medication in order to keep their blood sugar at a safe level or to keep their cholesterol at a safe level, then I want that person to be able to access medications. Why? Because basically, if somebody is not able to afford medications, then they, for example, if they have diabetes, their blood sugars may be too high, and that can cause actually a lot of problems. So for example, the person with diabetes, and keep in mind, 1 in 10 Canadians have diabetes these days, which is quite a lot, right? So the person with diabetes is at greater risk for eye problems that can lead to blindness, at greater risk for heart attacks, which obviously can be devastating and or kill the person. They're at greater risk for kidney failure, which can lead to dialysis or needing a kidney transplant. They're at greater risk for amputations, right? They can have problems with circulation that can lead to them having to have toes amputated or more, which is devastating. And so that's why I'm a fan of pharmacare. So another thing that the Greens want to do is expand mental health care, because number one, right now we have insufficient numbers of psychiatrists, and particularly pediatric psychiatrists, in many places across the country. But also there's one big gap, because psychiatry is normally covered by the provincial healthcare plans. But what is not covered is psychology. So, and psychologists are the specialists who normally, they do something called like the psychotherapy. So they'll talk to an individual and they'll help a person to basically to sort out issues that they're having that impact their mental health. One example is something called cognitive behavioral therapy. But anyways, psychologists right now, you either need to have usually over $200 for 1 hour with them, or you need to have a really good benefits package. And good benefits, oftentimes they'll only allow for 6 encounters with a psychologist per calendar year. So, and that's grossly insufficient. So to me, beefing up the mental health piece is really, really important, because right now there's some significant gaps in mental health care. And people are suffering because of it. And our economy suffers because of it too. Another piece about mental health, decriminalizing all drugs. This is a major piece of the Green platform in healthcare, and I'm in complete agreement. And a couple reasons why. Well, what we're doing right now, how's that working out for us? Over 4,000 Canadians from all parts of the country died last year because of the opioid crisis. Clearly our strategy on drugs, the quote-unquote war on drugs, has not worked up in Canada either. So I think it's time to try something new. Portugal tried this about 20 years ago now, I think. And many people said the sky would fall, crime rates would soar, and things wouldn't work out. But Portugal decriminalized all drugs. And because they did that, they were able to basically target the resources that were going towards policing for drug issues. They were able to take those resources and put them towards prevention and treatment, education, that sort of thing. And what they actually found over the subsequent years is that their drug use rates have actually dropped as a result. Anyways, and then finally, so we've talked about pharmacare, we've talked about mental health, including decriminalization, basic dental. Basic dental, and unfortunately, when they costed it out, they realized, the Greens realized that they could only afford to offer basic dental to low income. But I would argue those are the people who need basic dental the most. I saw them when I was a resident working at the Queensway Carleton here, in Ottawa. People would come into the emergency room, and I've seen them as a family doc, just working walk-in here in Canada, even in the last year. People will come in because they can't afford to see a dentist, and they have an abscess, and they're in agony, and they need an antibiotic, which is a prescription medication, in order to be able to help with the pain, decrease the pain and the agony until they can afford to see a dentist. They won't even ask for pain medication because they're so afraid of being labeled, a drug seeker. But they just need antibiotics to control their pain. So, with the suffering I've seen, I'm very much a fan of basic dental as well. That's it for a very small précis on the Greens' plan for healthcare. Good night.